Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Let's start with news that Selangor and some areas of the Klang Valley suffered yet another water supply cut, the third in 2 months. Now, over 1 million households and premises will have been affected. And I think, Sharaad, a lot of users in the Klang Valley, myself included, getting quite upset and tired of these frequent cuts 3 times in the space of 2 months.
Yeah, so the question, as we've brought up in this show many times, of the reasons, the source of the problem, because we know it's pollution, but of course with pollution comes questions of monitoring, both the issue of legislation, right, illegal factories, which I think the Selangor state government now denies any illegal factories in fact exist along the water system. I think there was a clarification that the pollution is coming through the drainage system. Now, all that aside, it's all well and good to have it explained to you. The question is, why do these things continue to happen? Maybe it's the size of the catchment area, Melissa. Yep. And then ultimately, as consumers, because we pay for this service, we're not getting water free. Should we be able to get some sort of compensation when our lives or our businesses are affected? Definitely.
There is a monetary cost to all of this. And I think that's something that has been, I guess, not yet fully addressed by the water authorities. I do want to mention something. You talked a little bit about monitoring, Sharaad, and I think the authorities have said that drones will now be used to monitor the Klang River Basin, Selangor River and Sungai Langat, and the idea is to use the technology of drones to not just monitor but also to take samples in remote areas more accurately. The question is, I hope that even with monitoring there won't be any loopholes. We have CCTVs everywhere. Is that good enough to prevent future incidences?
Yeah. Well, prevention is one thing, and maybe it comes with the effectiveness of that technology. But whether, in fact, the technology is going to be used quite in the way that it was designed, I think this is the perennial problem with technology being taken up in this country. We always talk about maintenance or the lack of maintenance culture. The other thing is whether they're going to be used sufficient in a way that makes them really effective. And I think that is, again, you mentioned the CCTV. We know they exist. Is it been proven that the police catch more people as a consequence, or has it allowed them to prevent crime as a consequence of having those CCTVs?
Are drones going to be a deterrent? And will this be random? Will it be at times where you won't be expecting it? Potential perpetrators won't be expecting it. I think all of that is how you use the technology is something that I'm very curious about.
Yeah, actually, one of the headlines that came out suggests, that military-style drones are going to be flying over, these areas. Almost as it suggests that the drones will somehow shoot down these perpetrators. But that might be too much to hope for. I think what is more likely to happen is a much more sophisticated system. And the issue, as has been mentioned on this show, are there enough monitoring stations along the riverway so that
early detection.
Early detection is one thing. It's not just early detection, but it's detected at different parts, and so there could be an early warning system. Again, we talked about this on the show with one of our expert guests who said that what we have is kind of scheduled monitoring of the water system, not pollution monitoring.
Exactly. All right, we're going to look at other news of the day. We also like to address the rumours of a possible cabinet reshuffle that's been lingering around. Today, UMNO President Datuk Seri Zahid Hamidi had reportedly met with Tan Sri Muhyiddin Yassin over quote-unquote new conditions for UMNO's continued support of the Perikatan National-led government. Now, previously, UMNO had said that it was considering withdrawing its support for Perikatan and had set some new conditions for the government for its continued political cooperation. I think it's quite interesting, Sharaad, to take a look, because over the next few days, what we'll be watching out for is to see how exactly Tan Sri Muhyiddin Yassin will be trying to address this dissatisfaction within UMNO. It may not even come in the form of a cabinet reshuffle, but he has to do something, and it would be interesting to watch what it will be.
Yeah, and this, is a story that requires perhaps a 1-hour show, Melissa, I think, and multiple points of views, because what we do know is there are, in fact, several plot lines, as it were, all kind of running in parallel. This recent crisis sparked by the claims made by the leader of the federal opposition, that's Sri Anwar Ibrahim, that he had the numbers, that, in fact, the current administration has lost support within the parliament, and therefore there should be potentially a new government in place. And that sort of unraveled, as you know, over the last couple of weeks in very interesting ways, revealing things that we didn't know before. Say, for instance, Najib Razak's indictment of the current Muhyiddin Yassin administration, where he claims that UMNO came in to support Perikatan Nasional at the behest of the Agong. And so very interesting elements added to these different plot lines. The question for many Malaysians is, will this, whatever move that happens, improve governance in the country?
Right.
That's something, Melissa, are you confident that a reshuffle, an expansion of the cabinet, inclusion of various other people who are unhappy, will that help the management of the economy and the pandemic? Well,
it's very interesting that you would say, not just a reshuffle of the cabinet, but perhaps an expansion of the cabinet. And I think that is where, I'm not sure if that is the case, expanding the cabinet members to keep everyone happy, how well that would go down with in terms of public optics. I'm not sure the public would be very happy right now dealing with the pandemic to see the cabinet grow. And I really do wonder, when we think about cabinet reshuffles, Sharaad, it's often because you think ministers are not performing in their portfolio, so they're moved around, right? Whether that will, improve governance, whether having someone new come in and take a new portfolio in the middle of a pandemic, I don't know whether that would be an argument for better governance.
Well, Melissa, many ways to kind of skin this particular cat.
You're right about the 1-hour show.
Yeah. If you look at what Najib Razak wrote as I said, in his indictment of the current administration, saying, well, in essence, that many mistakes are being made by the current administration, but Barisan Nasional and UMNO in particular taking the hit for that when their advice or their suggestions were not taken into consideration, or they were somehow left out of the loop. Now, there are many other dimensions to this, but clearly, and over the conversations we've had, many experts, UMNO is not one thing anymore. It's in fact several factions, we understand. And so who's pushing and who's pulling in terms of the current administration is very clear. Also, Melissa, a lot of talk the last couple of days, about the possibility of an emergency rule being called, or an interim government being called, put together in very different ways from what we expect. Sort of following on Datuk Sri Anwar Ibrahim's claim to have the numbers. So a lot of confusion, I think, in our political situation. Will stability provide greater governance, better governance? I don't know.
Okay, we're going to take a quick break. But after this, let's shift our attention to the situation in Sabah as the number of COVID-19 cases there continue to soar. That's all coming up in just a couple of minutes. Stay tuned to consider this.
Rangsangkan perniagaan dan jenama anda melalui SME 360. SME 360 mampu meluaskan
Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Today, there were 643 new COVID-19 positive cases reported in Sabah. This out of the 865 cases nationwide. Now, according to the Sabah COVID-19 spokesperson, Datuk Sri Masidi Manjun, Sabah has 5,048 active cases right now, which means Sabah has 67% of all COVID-19 cases in the country. This despite only having 12% of the population. While it's important to recognize that important steps have been taken in the past week, however, Sabah's situation remains dire and much more needs to and can be done. Joining us on the show tonight to discuss this further, we have Professor Datuk Dr. Subramaniam Muniandy. He's the president of the Malaysian Medical Association. The MMA has recently launched a Sabah COVID-19 fund for donations, which will be used to purchase healthcare equipment, medical supplies and PPE for Sabah. Dr. Subramaniam, why the need to solicit private donations? Is the government out of money to help Sabah?
Well, the government should actually put in more money. I think it is not enough at the moment. So at the moment, the urgency of attending to this emergency demands that we quickly have to raise some funds. It doesn't matter if we have more, we can share it with other states, but we will need to go for the Sabah emergency quickly.
Dr. Subramaniam, as far as you understand the way in which the healthcare system works, I know that it's been reported that you've called for the government to release emergency funds. Do you think that they're dragging their feet, or could they be working in a much more expedited fashion around the supply of these essential health equipment and other sort of related things?
Well, I think they should release the funds much faster than that, because the way the disease is spreading in Sabah, it is very alarming. Look at that. I think out of the total in the country, nearly about 2/3 come from Sabah, and the death rate also is increasing. Now, the Sabah Health Service is trying to handle as much as possible. They've opened up some centers, but then they've opened up what you call community halls, they've opened up sports centers, yet they're not able to handle. So I think there must be funds in to overcome all these serious cases quickly.
Okay, the Malaysian Medical Association was also reported saying that it would be better to allow states to act independently to tackle the pandemic. Now, if I may quote, "This is why we are suggesting for the government and health ministry to let the State Crisis Command Centre coordinate all activities and ensure the needs of the state are met on all fronts." Why, Dr. Subramaniam, did MMA make this comment?
No, MMA Sabah has made this comment because there is no center from which there is centralized movement of action. You see, many hospitals are distributed in different parts of Sabah, and if you don't have a central command, it's very difficult to distribute it equally and manage according to priority of the needs priority. So therefore, I think that is what we want to do in creating a central command area.
Dr. Subramaniam, some people have the opinion that it would be best for all the kind of management of the pandemic to come from the federal government, that in fact the states should be kind of subordinate to the federal government in the management. Do you agree?
No, I think yes, they must come from the federal government. But having said that, I think the state must have its own responsibility. It is the citizens of that state that we are trying to look after. The federal government should work with the state government and try to get this fund out and distribute it to where the need is very urgently.
Okay, well, you know, the principle behind, we've been told for the past 7 months or so that the principle behind lockdowns was to help flatten the curve, to allow time for health authorities to build capacity, to increase the capacity to be able to cope. Now, did that happen in the case of Sabah? Were the previous 7 months used to build capacity in Sabah's healthcare?
I think there are a couple of things that they can do. The Sabah healthcare is handling not only COVID, but so many other cases. So I think the government should, the health service should prioritize and use the main health centers for testing all these COVID cases, treating the COVID cases, and allow all the non-COVID, non-communicable diseases to be actually sent to the private clinics. And the government should pay the private doctors a consultation fee. For drugs, they can prescribe medication and they can come to the government sector and collect the drugs, because some of these drugs are quite expensive. This will actually give more manpower and release manpower as well as workload in the clinic kesihatan that they are so being overworked at the moment.
Right, so Dr. Subramaniam, this exactly is the call that that MMA, which you lead as president, made about allowing the private sector to kind of step in to help the pandemic. So you're seeing a kind of a division of labor between the public hospitals dealing with the pandemic and then for all the other cases to be shipped. Is this a question of money? I mean, is this too expensive a solution? Because private hospitals presumably charge more than public hospitals.
Well, it's true. But I am not telling private hospitals as such. There are private general practitioners to whom the government should pay for their consultation of managing non-communicable diseases, and let the health centers look after the communicable diseases. For screening, they are overworked. They are unable. You know, I heard a case where testing has been done and people cannot get the result for 4 to 5 days. And then they realize it is already, it is positive. Now, at the moment, I believe Sabah is heavy rain and flood. Transport cannot access these people. Therefore, they cannot be brought in for treatment. And I think these are things that must be overcome.
Okay, and finally, Dr. Subramaniam, the question of COVAX, MMA is also, is in mid-September, was urging the government to explain its position. Sounds like MMA is for Malaysia's participation in the International Vaccine Alliance. What do you understand is the current situation? Because it seems to be a lot of, or lack of clarity around it. What do you understand about our position vis-a-vis COVAX?
No, Malaysian government has agreed to participate in this COVAX, which is actually, we haven't yet found the vaccine, but we are trying very hard. And very recently I heard ministry or the government is trying to buy the vaccine from China first and try to see what can happen. Now, creating a vaccine and using it in people, it is a long process.
All right, thank you so much, Dr. Subramaniam, for speaking with us tonight. We're going to take a quick break, but we will come back with more on the situation in Sabah. Stay tuned to Consider This.
Anda dinasihatkan untuk tidak mudah mempercayai berita yang tidak sahih.
Thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation about the COVID-19 situation in Sabah, said to be the epicenter of Malaysia's third wave. Joining us now, we have Dr. Nirmala Pathy, Public Health Medicine Specialist and Associate Professor of Epidemiology at University Malaya's Faculty of Medicine. Dr. Nirmala, can I begin with getting your assessment, your understanding? What do you understand to be the situation in Sabah right now?
Hi. In terms of understanding the situation, Sabah has seen an unprecedented increase in the number of COVID-19 cases in the past month. So people have been naming it like Little Wuhan and so on. While this alarming rise in the numbers have been attributed to the backlog in testing, I find it particularly worrying to note that a high number of cases whose source is unknown. So this sort of unknown sources are often referred to as sporadic cases. And when we have a lot of sporadic cases, it's an indicator of widespread community transmission. So quoting from Code Blue, publicly available data shows that 9 out of 10 sporadic cases over in the national level is from Sabah. And about a third of the cases in Sabah in the past few days are in fact sporadic cases. So that appears to be community transmission. And the numbers that I'm giving is more optimistic because we have not really tested statewide in Sabah.
Nirmala, what do you think has gone wrong?
Good question. What do you think has gone wrong in terms of the increasing number of questions or in the increasing number of test cases? Or
Indeed. Why are we seeing Sabah turn into the epicenter of this pandemic for Malaysia?
One thing is we have a lot of vulnerable population there. And so we have a few things going on there actually. So on one side we have the community transmission. So it's outside the clusters. We don't even know where the cases are coming from. And then we have Sabah, which is relatively a poor state. And we also have a large population of immigrants who may not be coming forward for testing. So we have one side, we need to test more. And on the other side, we have a population who may not necessarily step forward for testing.
Okay, so on the note of testing, Dr. Nirmala, you mentioned the backlog a little bit earlier. I do want to, could you help us think through this, how we should be looking at testing and tracing capacity in the case of Sabah?
For Sabah, the short answer is we need to test. Previously, when we had the second wave, it was a bit different, but in Sabah it's different. The reality is that in Sabah, we need to test more, but on the other side, our testing capacity using the gold standard method, which is RT-PCR, is very limited. So and it will not be able to cater for the crisis that's going on in Sabah. So we know that Ministry of Health has said that they are increasing the testing capacity for RT-PCR, but it might not be helpful. So even though we have, they have been saying that they're going to fly the samples to Peninsula with special flights, let's hope that it works. But assuming that logistics is not an issue, the success also depends on whether the labs in Malaysia are able to perform the testing, and there's no backlogs. And we also have our rising numbers over here. So at this rate, we have no choice, but I think we have to rely on antigen testing, which is cheap and also gives quick results, in fact, in a matter of minutes. So although these antigen tests are not sensitive and may have false negative results, I think the motivation here is to isolate the positive cases quickly and break the community transmission. So we have to go along this route. And government has taken the right step. So, for instance, it has been said that they are going to fly like 100,000 test kits to Sabah over the coming months. But this number is not enough. Because what it looks like, Sabah needs like 100,000 antigen test kits per day to run that sort of numbers in the test. Because there's so many red zones. And also there are red zones that are waiting to happen. So we need local mobilization of civil societies in Sabah. So the mobilization is to get these test kits to also all the areas where people cannot reach, to underserved populations, including those in the rural and remote areas.
Okay.
These people may not come forward for testing.
Right. Dr. Nirmala, did we fail to up the capacity for testing when there was, in fact, a lull in the pandemic? Did we not use the time that we had to build that testing capacity? I mean, I'm just following on your statement about the backlog. Was the backlog a question of capacity or lack of capacity?
They have actually. What happened was, like let's just look at Sabah, because they did increase the capacity. So according to Ministry of Health, they had doubled the capacity for RT-PCR testing, for instance. But I just think it was not expected that Sabah will reach this stage at what they are at this juncture. So even with the increased capacity or doubling of capacity, it is not enough to cater for the current crisis. That's why I was already talking about using antigen testing instead of RT-PCR.
there have been 12 consecutive days of COVID-19 fatalities in Sabah, totaling 47 deaths. Now, 40% of COVID cases in Sabah have severe symptoms. If you compare that to the rest of Malaysia, it's 12%. Dr. Nirmala, do you think more testing will help stem this number, this worrying trend?
In fact, this sort of question has been brought up earlier by someone else. I'm not so sure whether what we are seeing is really that we have a more severe disease, or is it simply that Sabahans are not turning up to testing and they only wait till they are very ill. So even what we are seeing are actually the sick patients, and those who are relatively well with symptoms are in the community and we are not testing them. So that is something that we have to sort out first. And indeed, when we ramp up the testing, this may be addressed to a certain level, but ramping up testing alone is not going to be enough. Because, like I said earlier, there might be people who do not want to come forward for testing.
Dr. Nirmala, at this point in time in the pandemic, do you think there's a need to shift the strategy? I mean, you already mentioned a difference in testing regime from something much you call the gold standard to something that's quicker, perhaps of lesser quality maybe. But beyond that, what else do you see is necessary to shift or recalibrate in terms of our strategies?
In terms of strategies, I think everyone is talking about testing, talking about contact tracing, and all the public health measures, which are really, really important. And of course, we're also talking about beefing up the healthcare system, having more beds, and so on. But I think what we are lacking and not thinking so much is about the problems with Sabah, which is special. So on one side, we have the Sabahans who come from low-income families and they're working in informal sectors. And these people live one paycheck away from poverty. So even if we ramp up testing, they would not want to come forward because they cannot risk quarantine, isolation, because it means that they cannot work, they cannot feed their families. So this population needs testing brought forward to them, and that's why I was alluding to using NGOs to get test kits across, and also to get medical personnel, volunteers to do the testing in underserved population. And at the same time, we must also assure these people that while they are being treated, isolated, quarantined, whatever not, their families will have food. So food security is the other thing that I think the federal and the state government, so these strategies, although it sounds not really coming from the medical end, these are important to make sure that people will come forward for testing. So just offering testing alone is not enough. We must make sure that people come forward for testing. And also we have these undocumented migrants. They are fearful of coming forward. We know that from the second wave, those who came forward were arrested. So this might actually create the fear, and they are not going to come forward. And they are mixing in the society in Sabah. Right. So these are things that are beyond the health systems and need really closer inspection, and we need to take action. Otherwise,
Dr. Nirmala,
any other strategies will not work.
Thank you so much. I mean, that's a very valid point, and we really appreciate you sharing your insights with us tonight. Thank you for your time.
Thank you. Bye.
That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching. Good night.
You are watching Notepad. I'm your host Ibrahim Sani. Very, very serious numbers have been announced very recently, including the number of new cases being stubbornly at above 800. Very, very recently, we've had this whole new